Spring sports. Many kids in our area will be playing baseball over the next several months, but a warning for parents. The number of youngsters with baseball-related injuries has doubled in the last 10 years. And visit any orthopedic surgeon and they'll tell you why. Kurt Autry has our story, new at 11.
Sabrina, kids are throwing harder than ever before, and they're playing more months out of the year than ever before. And the result is what some orthopedic surgeons refer to as Little League elbow.
1, 2, 3, quarters!
A junior varsity game between Verina and LC Bird. 15-year-old Daniel Giardini is ready to play. In fact, he's somewhat of a baseball nut, at times playing for his school team, another team in the Appomattox League, as well as American Legion Ball. But all that throwing can take a toll on a young arm.
Probably whenever I was around 8 years old, I've noticed that it was hurting whenever I would throw with it. My whole arm would go numb, and I just shook it off, just kept on playing.
These are both x-rays of his right elbow, and this is the bone on the outer part of the elbow.
Every spring when baseball season starts, Dr. Vic Goradia sees many young players. This x-ray is of a 12-year-old boy who has a stress fracture in his elbow. Little League injuries have doubled in the last 10 years, and the reason? So many leagues. Many kids are playing in multiple leagues, 8 or 9 months out of the year. And repetitive motion injuries in kids whose growth plates are immature can be painful.
They get something called a little leaguer's elbow, which is an overuse injury that an adult might get, like a tendonitis, but in kids, it causes a lot of pain and discomfort.
Last season, the pain became too much for Daniel to bear, and he went to Dr. Goradia, who quickly decided that surgery was the only answer.
And in Daniel's case, the nerve was slipping up over the bone, so as he would go to throw, the nerve would slip up over the edge of the bone and would cause a lot of pain and numbness and tingling.
Daniel is better now. He still loves baseball, but he's cut back, only playing in 2 leagues this year instead of 3. And as for his arm since the surgery?
It feels a lot better. It's a lot easier to deal with. I usually take a few pain pills before practices and games, but I'm fine with it now.
Dr. Goradia suggests that if your child plays in 2 or 3 different leagues over the course of 6 months, make sure that he or she plays different positions. This will limit the stress on the arm and elbow and lessen the chance of the same repetitive injury. I'm Kurt Autry, NBC 12.